and we'll chat after. All right, can you hear me good?
Yeah, sure can.
All right, awesome. All right, so we're live. Welcome everyone. Those of you watching live, those of you watching replay. We're here to have conversations on how to thrive after trauma. I've I have to say that I got a lot of feedback on this topic. Like a lot of people, like yes, these are things we want to see, even if you can't watch it live. This is something, or it's something I can listen to live. I want to watch again and again because people are looking forward to thriving even after a traumatic past. So, welcome, Doc. Nice to meet you. And I appreciate you spending the time to come chat with us this evening. How are you doing?
I'm good. Yeah, I'm actually leaving Mexico City for 6 weeks, so that's why I'm a little.
Sorry, what did you say? I didn't catch you. What did you say?
I said I'm living in Mexico City for 6 weeks, so I'm a little fuzzy.
Oh wow. Okay. Well, that's good. That's good. All right. Awesome. Now, for those of you watching live, hashtag live. Those of you watching replay, hashtag replay. Please invite friends. We'll talk about thriving after trauma. Questions will be answered live. So, by all means, please bring your questions. And that being said, Dr. Christy, I believe Dr. Anita Luanga introduced us. So I'm glad for the connection. And so, Doc, if you don't mind introducing yourself, who you are, what you do, and why you do the things that you do.
So I'm Christy. I work as a family doctor, trauma therapist. So that's in Calgary, which is and I have based medicine for a really long time, like 16 years. And then I also was doing other international work, so this brought me to in 2015. And I wasn't there from the earthquake. I was there working as an academic consultant, program design for them. So when the earthquakes hit, I wasn't in a position in a way that I had thought I might. But what I did experience was great traumatic stress symptoms. And when I started to research how trauma shows up in the body, because it was happening to mine, I recognized that I was at work. And then when I transitioned into family practice, I had been running our health for a long time. And what I came to recognize, denied communities universally face trauma. And I didn't have any tools in my toolkit. So I spent the next number of years trying to gain and share those.
Well, awesome. Wow. You turned your pain to purpose. So thank you so much for sharing. And do me a favor, some of the, like when you speak, some of the words do break up. So maybe speak a little closer to your mic because I want to capture everything. I don't want to miss any word. I did look you up, and I'm honored to have you on here. All right. Now, I will say this, Dr. Christine Gibson is also the author of the Modern Trauma Toolkit. And she's also a TikToker and a TEDx talker. That's the way it's phrased. All right. And she runs a company where she trains professionals on how to manage workplace psychological safety. I love what you do. So safer spaces training, but how to manage workplace psychological safety. I like that. So powerful woman here. All right, Doc. My first question to you is: when we say thriving after trauma, and there's a phrase that's usually used. It says "time heals all wounds." What's your response to that comment?
That's something nobody's asked me, but I'm a little torn on, because I don't know that that's necessarily true for everybody. Sometimes people traumatic associations actually get worse over time.
Hmm.
Every time that you experience something that reminds you of the traumatic event, and you're not in a calm, your amygdala stores associations. So, yeah, that's a tough one.
Yeah, it interrupts. So it's not necessarily true for everyone.
It's not, but you can hear that the secret is learning how to be in a calm body, even when you're triggered. So I do believe that all people have the capacity to learn how to do that, but I'm not certain that everyone can innately figure it out on their own. I mean, it's why I joined social media, wrote the book.
Okay. Thank you. Now let's talk about surviving trauma and thriving after it. Is it possible? This sounds like a silly question, but is it possible to thrive, not just survive? But let's talk about a difference. Someone who's surviving trauma versus someone who's thriving in spite of it. Uh-oh.
Sorry, I just noticed that my network connection is weak. I tried to strengthen it there.
No.
So survival is just kind of like you still have a pulse after. But I do find that for a lot of folks who are stuck in trauma response, what they end up losing is trauma and activation in the brain kind of forces you down these paths that are reflexes. And that reflex sends you into fight and flight, freeze and collapse. And it's really hard to thrive when you're stuck in one of those overactive or underactive responses. And so to recover from trauma and thrive means you have agency to control back.
Okay. So gain part of the control back. Sorry, I'm having a hard time hearing you very well. So I'm picking the words, but I'm picking the words you're sharing. So gaining, so there's a loss of control and loss of choice. I did hear that. And then the point is to gain some control so you're not always stuck in the extremes of responses or triggered responses. Did I catch that well?
Yeah.
All right, awesome. Now, how does sometimes in conversation with patients, the responses, I wish I can erase the thought, like you don't know what I've been through. Like it's hard to undo the scenarios. Like it plays over and over in my mind, and so of course trauma can affect the body and also the mind. For someone who's struggling and who is open to the idea that they can thrive even after a horrific past, what would you say is a healthy first step toward recovery or toward healing?
I think part of that is befriending your nervous system
Hmm.
so that you learn what messages are coming up. And then you have these reflexes that you can bring into conscious control. So what we're trying to do is to make these subconscious processes, bring them into our awareness.
It's almost like feel your feelings.
Yeah, but also know where they're coming from. So let's say somebody has a high heart rate and they're feeling nauseated. because of their painful past experience, they might experience those symptoms as fear. Whereas another person might experience those exact symptoms as excitement. So feeling our feelings is really complicated. It's coming up as a message, and then it's perceived. And we can actually shift it either through the message, turning it all down, and also through perception.
Wow. Wow. And for why would you say that? It sounds like it's easy to do, or something that I guess can get better when practiced. For someone who's listening, who's like, I don't want to relive those feelings or those emotions again, so I tend to shut them out. Um, that's usually maybe some of the pushback I've heard patients give us. I don't want to talk to a therapist. I don't want to relive or retalk. I want to talk about things that make me feel a certain way. Any words of encouragement to address some of the fears that come with maybe reliving some of these experiences?
I tend to practice different kinds of therapies where you could go through the entire process. So I work with refugees. Some of them aren't capable of sharing, like, the horrifying things they went through. And there's a lot of therapy, accelerated resolution therapy, brain spotting, even EMDR to some extent, where you don't actually have to tell them. So for people that are really feeling like that's a barrier, finding the right therapist will either help you relax and be able to tell your story in a neutral way, or use a modality where you don't even.
Okay. So there are many therapy options. You just got to find the right fit.
Exactly.
So, the message here is not to give up. The right therapy can help you, um, push through some of I guess, the effects of such past experiences, but help you thrive. This conversation, I'll be honest with you, as I'm sitting here and talking to you, I'm like, oh my goodness, this is very deep. I can imagine the pain of reliving some of the conversations, or the soundtrack in the mind, the video track playing over and over again. But we're having this conversation with Dr. Christie to let you know that there is hope. There's not just one kind of therapy, a different kind of therapy options that can help with reprogramming, for lack of a better word, or restructuring how those triggers are received, perceived, and how much they affect you. So don't give up hope. We just got to find the right fit. So that's what I'm hearing. And Dr. Christie, we're gonna have to do this again, because I feel like we're not capturing the essence of you because of the but we're gonna make this. This is gonna be our first one. But I will definitely love to have you on again, because these are powerful conversations. And just listening to you, I'm like, I didn't know I mean, there are many types of therapy, but you're talking about different dimensions of therapy. And so, yay, this is good. Now, one of the things that I think is a fear for many physicians, or maybe should I speak for myself, or clinicians, is saying the right thing. Someone who has gone through something that you have no idea about, you can't even imagine. So let's start with loved ones, people who, care about this, this client or this patient. Are there tips on how people can best have this conversation? Um, Especially I would say as maybe friends or family who want to support someone going through trauma, like without saying the wrong thing. Uh,
And it's going to be different for every person. So So for every person that has stored trauma, so you can have a specific experience and not necessarily experience traumatic responses in the brain. But for the people who have, those associations are going to be very personal. So the things that might trigger them are sometimes hard to predict. So a lot of it is just paying attention to their body language, their tone of voice. One thing that can be really helpful is for us to help with co-regulation. Trying to stay in a calm nervous system ourselves. So when we get into an overactive state, that can cause the other person to activate in the same way, and for them, it's experienced as a traumatic association.
Okay. So what I heard was you got to pay attention to what they're saying without even the words. So the body language, you got to be a little more sensitive and more aware. So not be dismissive. What may be not a big deal to you could be really, really inducing to someone else. So paying attention is very, very important.
Well, and be careful like you might hear where all three kids experience, and one kid might say that was really traumatic for you. And that's true for them. Like this experience is really serious. So just believing somebody when they say I was experienced in a traumatic way by my brain. And I think you kind of touched on it before, but not forcing anyone to tell you this, because that can make it worse.
Wow, don't force anyone to tell their story. You don't have to. Can make it worse. And then listening and believing people when they say or they define their own trauma. Believe people when they define their own trauma. Don't try to explain their way. That's not yours too. Okay. Thank you. Thank you. Now, are there small daily practices or practices that you would say can help people with regulating their emotions? I know this is this everyone is different, but generally speaking, are there small daily practices that one can do to help regulate emotions or anxiety after trauma?
And this is exactly why I wrote my trauma toolkit, is because I didn't learn this stuff in med. But it was really helpful for me to do in between patients, to help my nervous system regulate. And then I can teach these techniques in 1 minute, which is what brought me to TikTok. The kinds of things that I teach are breath. So when you're trying to let activated nervous system to really emphasize your out breath. I tell my patients, make a really fun music. And if you hum or sing along, you're exhaling. So I try to make it fun, because even a simple play activates a bit of that parasympathetic or the calm nervous system. So first, checking, am I in fight or flight, or am I in freeze collapse? And then modifying it. Another one I use a lot is soothing touch. The one I learned is called the behavior technique. And it's kind of like how humans are puppies. But just like a puppy, they also like to be pet or brushed. So across the palm of the hand, the shoulders, and the face are places where there's measurable impact on brain waves to notice that the brain is calming.
I like that. So that's why emotional support animals are also good. Yeah,
Well,
so you
I
can
think
help yourself.
sometimes when we don't have our
When we
thinking,
don't have our thinking,
the best doorway to
the
help
best doorway to help with
is the body.
is the body.
And in
And
medicine, we're
in
taught
medicine,
cognitive therapies fix everything. And I'm a huge supporter or proponent of somatic or body-based therapy. And that's a lot of what I learn and teach.
Our Wi-Fi today.
Because
Yeah,
trauma is
lost you
stuck
for a
in
second.
us, so
Mhm.
it makes sense
it makes
to
sense
work with the nervous
to work
system
with the nervous system
and the body
and the
to
body
unlock it.
unlock it.
Okay. All right. Thank you. Thank you. Now you mentioned TikTok. Before we go there, before I go there, because I want to share your TikTok with our viewers. What's one myth about trauma or healing you wish everyone will stop believing?
Um,
Um,
I think it's the same as any
the
mental
same
health
as any mental health
stigma is
stigma
that
is that
you could
you
choose
could
to
choose
snap out
to
of it.
snap out of it.
Nobody with any mental
Nobody
health
with any mental health
issues
issues
chooses to have these
chooses
symptoms.
to
They're
have
very
these
uncomfortable.
very uncomfortable.
Mm,
But that being
mm,
said,
That being
there is
said,
a pathway for all people.
for all
You know,
people,
for a lot of folks, they
for
get
a lot
kind
of
of
folks, they get kind of
stuck with their
stuck with
identity,
their identity
getting tied up in
and
trauma.
tied up in trauma.
mm,
And
And
there can be a time
there
where
can be a time where
that event or that relationship
that
is
relationship
something you might feel more neutral
you
about.
feel more neutral about.
mm, mm. Thank you. Thank you. Thank you. Thank you. Um, you know, I said this a few times too. I don't think anyone chooses to struggle or have mental health issues. Just like no one says, you know what, today we'll have high blood pressure, right? So thank you for highlighting that. Now, for those who are wondering where they can follow you to learn some of this simple or easy to implement hacks that are actually fun. I like the music loop with what you mentioned. Where can people find you so they can follow you? They can learn more about how to thrive even after trauma. Doc, where can people find you?
So my TikTok
My
handle is
TikTok handle,
TikTok Trauma Doc.
Trauma
And the book is called The
and
Modern
it's
Trauma
called
Toolkit.
Trauma Toolkit.
The website is just
The website is just
moderntrauma.com.
modern.com.
All right, and I'm putting all that information um, in the chat for those who are watching. I
If
put
anyone wants
TikTok.
to,
If anyone wants to,
reach out in terms of
reach out
a
as a
speaking gig or
speaking gig or
working for a workplace or training
workplace or
physician,
training physician,
they can find that
they
information
can find that information
on .net.
on net.
Okay. You're also on YouTube. You're on Facebook. You're on Twitter. So I'm trying to put, and you're on Instagram too. So all that information is going to be put in the comment section, and also you see it at the bottom of the screen. You have a Twitter, Gib Trotter, MD. Is that correct? Is that you?
Oh yeah, that's on Twitter,
Oh yeah,
but I
that's on Twitter,
actually
but
haven't
I
logged into Twitter for a year now.
Twitter for
All right. I'll put your YouTube as well, and then your website, so people can get the book. And then you also have www.christinegibson.net. Let's put all of that here. So I would advise you go watch, go follow her, learn practical tools to thrive even after trauma. And your name speaks it all. Modern trauma. You're the TikTok trauma doc. that has a that has a ring to it. TikTok trauma doc. All right, and also on Instagram. Doc, you didn't share all your handles. You're all over the place. You're
Yeah,
everywhere.
my Instagram is pretty weak.
Instagram is pretty
TikTok
weak.
is where I post
I post
the most,
Well,
and
you're a TikToker.
archives. All of these 1 minute
all of these
practices
1 minute
are
practices
called Healing Skills on the TikTok.
On the TikTok? Okay.
That's the one to follow.
Okay, so she's saying if you had to pick one, the TikTok is the one to go follow and watch, and she has a lot, and you have a good following there as well. So, Doc, thank you so much for what you do. I will be reaching out to you via email to schedule another one next year, so we can have a part two of this. I'm not happy about the glitches, but we got a lot still, so I'll I'll take it. Thank you for what you do. More grace, more strength to you. All right.
Thank you, and
This is
I'm so
much needed.
sorry.
Well, that's okay.
Zoom has been fine, but noticing it's a StreamYard.
That's okay. That's okay. We're going to have many opportunities to do this again. So I'm glad that we got to connect, and thank you again for joining. I would appreciate you, those of you watching, if you show us some love in the comments. She's a busy woman. She chose to come hang out with us today to share her wealth of knowledge so we can thrive even after trauma. Thank you again, Doc. I appreciate you.
For sure. Thanks for those. We'll chat again.
No worries. Yes, we will. And thank you all listeners, those who are going to listen and replay, those who are listening live. I appreciate you joining. As always, caring and sharing. You can forward this, you could share this link or forward this video to those who could use a whole lot of encouragement in this season. And as always, if you or anyone you know is looking for an awesome, a thorough, and compassionate family physician that will help you live long and well and have conversations like this to help you do so, I am she. Have a good one. Thanks again, Doc. This was good.